And the whole idea is to put a human face on the kinds of jobs that we're talking about in this conference, the kind of jobs that have the issues that we're discussing in the white papers, and to basically hear from some of the workers, and we have 3 workers representing the hotel worker, a home healthcare worker, and a food service worker, restaurant worker, to just give us a sense for what they have to deal with in their day-to-day jobs, and especially around health and safety. And to help tell their stories, we have Jack Dopplet as a moderator. Jack is from Northwestern University, very esteemed career in legal and journalism, and really has done a lot of work to, especially with immigrants, to bring out the stories of immigrants here in Chicago. And it's been a tremendous help to be able to talk with the workers and have them sort of bring their stories to you. So, with Jack will introduce them, and we'll start the panel.
Thank you, Peter. It's a pleasure to be here with you guys. I hope you're enjoying the conference in Chicago. For those of you who aren't from here, yeah, be enjoying the conference. That's good. I think of this somewhat like Peter does, but I don't think of it as trenches. I actually think of it as that kind of invisible, the curtain behind which people are in our daily life that we kind of generally look the other way. We're talking about our homes. We're talking about the restaurants we go to 2, 3, 4, 5 days a week for some of us. And we're talking about this place, a hotel, where people are working, where we're doing what we're doing. And much of the conversation we're going to have for the next 45 minutes, it's really going to be a conversation. Feel free to raise your hand if you want to enter the conversation. Is really just about daily work life. So first, I want to introduce Muriel Jones to my right. Muriel works in the home. She's a home care aide and has been for the last 11 years. Before that, she was a buyer. She is also connected to SEIU, as all 3 of the people up here, not coincidentally, are connected to labor unions. She's a steward and is also on the executive board. She's also a presence in her kids' school. She is a single mom and has 2 kids, one in college and one in high school. She also suffers from lupus, which is, of course, a disease that affects the immune system, but that it can be triggered by almost anything and can affect almost any part of the body. And lastly, one of the things about Muriel that I bring your attention to, some of you already may know it, but she was featured in a day in the life of home care, which was done by UIC's Department of Public Health and is on their website. And it's really, I think I got the name of Earl Dotter. Does that sound right? Anybody? Did a wonderful job with this. I really do point your attention to it. So Muriel, thanks for joining us today. Also joining us to our left, to my immediate left is Maria Garcia, and to her left is Gabriela Rivero. And Maria is a restaurant worker and has been since she came to this country 14 years ago from Michoacan in Mexico. She's worked in a number of different places and a number of different jobs. She's been a waitress, she's been a part of the kitchen staff, and she's been a cook. She's going to be telling us a bit about one job she had for a very short period of time. Our translator is Gabriela, and Gabriela works for Arise Chicago. She lives where I live in Evanston. She also, completely coincidentally, works in a restaurant also part-time because her family has a restaurant in Milwaukee, a Venezuelan restaurant. She shoots up there and shoots back and has her normal job at Arise Chicago. So please welcome the both of them. Maria also, by the way, has 6 kids, I forgot to mention, and lives in the neighborhood where I grew up in West Rogers Park. And finally, on the far end is Francine Jones, a member of the Joneses remote family. She is a housekeeper and has been a housekeeper for 20 years and has been a housekeeper for the same company for 20 years. They have a tumultuous relationship right now because she works for Hyatt. She has worked the entire 20 years for Hyatt Regency down the block a piece. And she came here directly from the picket line today, so thanks for doing that. She's a shop steward at Unite here and also on the executive board there. Lives in South Chicago, has a son who's 16 years old, and she grew up in Chicago, so she's a local like me. So let's start with Muriel. Today you're not at work, right? You're not, which means today you're not carrying something in your purse that you carry every day. What's that about?
I'm not carrying any gloves that I'm supposed to get every pay period. They give out 20 gloves for the next 2 weeks, and today I don't have any gloves. And the reason we have these gloves is for universal protection, even though they tell us about washing our hands. So I have more than one client. I feel that, when they give these gloves to us, they're telling us we have to change the clients, wash our clients up with these gloves, clean the house with these same gloves. It's not enough safety when it comes to with these surgery gloves that we use to perform our job.
So you kind of carry it with you wherever you go. This gets us to talk a little bit about the rules that exist in a workplace and the kind of shortcuts a worker has to take to either try to make the work rules work or to get around them in whatever ways you can make your job work. So the gloves, talk about that or talk about anything related to that. You've got 20 gloves for a 2-week period. Right. So what are you supposed to do to make that work?
Well, if the client can afford to buy gloves, I ask the client to buy extra gloves for our line and ask the company, I didn't receive any gloves when I picked up my check. Can you mail me out some gloves or can I come down and pick up gloves? Or I would just buy certain gloves, like I do light duty housekeeping, so I would buy certain gloves so I wouldn't have to use the gloves that the company gives us, which makes my job a little bit harder because they don't pay us enough to go out of our pockets to go and buy gloves. My clients, they be like, well, why don't you have enough gloves? I'm like, this is what the company gives to us. And
I'll bet each of you in your own world has an answer to the question I'm about to ask Muriel, and I wonder if it's the same or different. As you cut a corner on gloves or something, what corner are you cutting, and how do you make the judgment that that's the better way to do it? Because OSHA and all kinds of organizations have their own rules on what you're supposed to do too. What do you actually do?
Well, they tell us to the universal precaution of washing our hands, making sure that our hands are clean. But if probably you have a client who has shingles, or you have a client who is a diabetic, and you go empty the garbage and you find needles. Probably, you dispose of this being probably get stuck by these needles. You don't know if this person has AIDS or what. And through the training that me being very consistent in telling the union and my company that we need more safety and health in our company, I went to the union and I told them, look, there's a lot of people can get sick or somebody's going to be seriously harmed or someone can catch AIDS, with these needles and whatnot. And there's sometimes in the household you have more than one. You have other members that live in the household, You're not, you're only taking care of that client, but you're dealing with a whole aspects of things. And doing the training that we got with the UIC and SEIU, we trained close to 2,000 members to show them how to expose these needles and how to, how to expose the needles, and not only for your purpose, but for the purpose of the environment, purpose of your clients. Say for instance, you throw these, if I didn't know anything about this, if I threw these needles, I know this is needles in this garbage can, and I threw these needles out in the garbage can. The garbage man who picks up that garbage can stick his finger. And with that, he wouldn't even know why he got a disease or whatnot, So this safety and health and protection came about not only protecting me and my client, but protecting the community and the environment also. How we did that is some of our clients cannot, there's a sharp box for dealing with disposing needles and whatnot. A lot of our clients could not afford those boxes. We were taught to use detergent bottles, because milk bottles, the needles can always easily, stick through the bottles. And a lot of our patients didn't know. Sometimes the last thing that you stick your finger to take the sugar, some of them you find them all over the floor, inside the bed, and it's not safe, So we were trained to train. We were trained, and also we trained our clients how they can keep their home facility and keep them in our house, because we are the ones that really keep our seniors and disability people out of institution. We want them to stay in their household and feel more, safe in their house and live out their days comfortably, most as comfortably they can.
So you're not working in one place like the other two people on the panel are. Mm-hmm. You work your basic 40-hour week, right?
Yes, I do. I travel between clients. It all depends what type of client you have. I have a bedridden client. I have a client who just needs companionship. I have a client that needs assistance. When I say assistance, some clients can get up and go take their own baths. Some clients can't feed themselves, but they depend on me. And say, for instance, they have a family member. Sometimes you're there to relieve the family member, But working in my realm, you never know what kind of case you get until you walk into that household. And working with my my job is like a play. It's like juggling balls,
You do overtime too, right?
I do overtime.
Tell us a little bit about how overtime affects somebody like you who has lupus, and you got to make it work, and you're going from place to place.
For instance, before we had insurance, our union fought for home care, over 58,000 home care members to get insurance. We couldn't even get insurance. We were going to work sick, taking care of sick people, okay? And the state and the company pays this insurance, but it's only insurance for the ones who qualify for it. And at the time, I didn't have insurance, and I just claimed I did a slide on where USC had followed me day-to-day basis what I do. And that particular day, I had a temperature of 101. I had a streaming headache, and every joint in my body was hurting. But I had to go to work because I was a single parent, and if I miss a day of work, which we don't get paid for sick pay, we miss a day, that particular day, I had 3 clients a day, and believe me, I didn't have a lunch break. I didn't get a break. I had to eat lunch on the bus. I had to, in between my clients, we're not allowed to eat anything in the client's house. We're not even allowed to have a cup of water. Okay, this is the rules and regulations that the company gave us. And like I said, we fought hardly. In 2006, we finally got our insurance. When we got our insurance, it gave us a little leave, and we could go to the hospital. I had to go to a lot of people live in Chicago, Nostrovia, which is a public, like Cook County hospital. And if I got sick, I couldn't, if I missed a doctor's appointment, that means I had to go to the emergency room. I leave work like 8 o'clock at night. I would stay in Cook County Hospital until the following day until I see a doctor, get up and go to work because I could not miss the day off from work because I was sick. Or to get medicine. I couldn't even afford to buy medicine. So I was taking over-counter medicine to, just for the pain, which is not good. Like I said, now, since we got insurance, I'm doing much better. I can buy the medicine or get the medicine that I need. But there's a lot of workers out there who had back problems, and they're still lifting. We don't have the safeties of showing us. I mean, they teach us how to lift, but they don't give us the equipment to lift patients. I had a patient that was 600 pounds, and this patient was bedridden, and I had to really use my mind to make this person get out of the bed, okay? And sometimes I had help from a neighbor upstairs, and sometimes, I mean, that was a hard task to go through. I had to take a board and have her to slide into the wheelchair. Once I get her to slide in the wheelchair, I had to wheel her to the bathroom or carry water in a pan to wash this client. And I had to do all that in 3 hours. Then I had to feed her cat, her laundry, and you couldn't do that in 3 hours. I don't care if you were rich, you could not do that. But to do this job, you have to love this job. And I love the job because one day I feel that, I'm going to be a senior and I want someone to take care of me,
Last question before we talk to Maria. If you had to take a guess of all of the co-workers who deal with you in the home care industry, what percentage of them are working hurt? I think of, kind of the sports metaphor. Is the notion in your world that you play with pain? You just do it? Because otherwise you have to take off work and you don't get paid.
I think 60% of our workers work.
What are we talking about? What kind of injury, what kind of pain are we feeling?
Going to work with colds, going to work, some people who can't afford to get insurance, people who have to work because they have no other income coming in, people, immigrants, who can, find jobs and whatnot, and they're coming, they really take advantage of.
Okay, thank you. Maria. All right, so let's talk a bit about the restaurant world that we all eat in and look away and walk on. Are those mics on too? We can do this.
María, en este momento vamos a hablar de los trabajadores de los restaurantes, que nosotros vamos allí y siempre miramos hacia el otro lado.
Okay, so incident washing dishes with an industrial dishwasher you weren't familiar with. Tell us about it.
El incidente en el que estabas trabajando con una lavadora de platos industrial que no sabías cómo usar. Dime más de eso. Bueno, yo llegué ese día a ese restaurante a buscar trabajo. Me dijeron, sí, necesitamos una persona. Dice, aquí está la máquina y aquí están los trastes. I was looking for a job and I went to this specific place and I asked if they were looking for someone. They said yes, and they just sent me to the kitchen and gave me and wanted me to work in this humongous industrial dishwasher and I have never seen that.
Give us a sense. How's it different? Dishwasher is a dishwasher.
¿Cómo es diferente una lavadora de platos? Una lavadora de platos. ¿Cómo es diferente? ¿Qué es diferente? Pues es una máquina que, o sea, no es lo mismo lavarlos a mano que estar usando una máquina que nunca había visto. It's not the same to wash them by hand that uses a machine that I have never seen before.
What happened?
¿Qué pasó? La máquina no estaba funcionando, entonces yo la abrí y se me vino todo el agua caliente. The machine wasn't working properly, so I opened it and all the hot water fell on me. Y me quemé ese día. And I burned myself that day. Y yo le dije al encargado que estaba ahí, le dije, la máquina no está funcionando. Me dijo, sí, sí está funcionando. Dice, si tú vienes a buscar trabajo, tienes que saber cómo usar las cosas. I told the manager the machine wasn't working, and his answer was, it is working properly. If you're looking for a job, you should know how to use this machine. Y el problema fue ese que me quemé. Otro problema fue de que ahí en el área de trabajo del dishwasher, todo el techo está goteando grasa. Uno tiene que estar poniendo las manos arriba o toallas en el techo para que no le esté cayendo a uno. ¿Sí? Besides the bad dishwasher, also there's a lot of grease falling from the ceiling, so I had to put towels to sort of soak them up from falling on us.
All right, so that day she gets burned, right? What does she do, and how do the people around there treat her? What happens next?
El día que te quemaste, ¿qué pasó y cómo reaccionó la gente con la que tú trabajabas después que te quemaste? Pues ellos me dijeron que como vieron que me había quemado, me dijeron que me pusiera una pomada. Y me dijeron, ok, deja eso y ahorita lo vamos a arreglar. Pero también lo único que no me gustó así, que se empezaron a reír de mí. After she burned herself, all they said was to go and put some lotion on her hand. And after she told them that still the dishwasher wasn't working, they just started making fun of her and laughing at her.
What should they have done?
¿Qué tú crees que ellos deberían haber hecho? Pues yo creo que prestarme ayuda, ¿no? They should have helped her. Y no estarse burlando de mí. Not making fun of me.
All right, so in a setting like that, what do you do, Mike? Oh, thank you.
In a setting like that, you have anyone has a couple of alternatives, and you have some other issues, language barrier, etc. So what's available to you to do? What can you possibly do?
En un ambiente como ese, con diferentes situaciones, con la situación que tú tienes de la barrera de la lengua, ¿qué tú crees que se debió haber hecho? ¿Qué se debió haber hecho?
What's her case? What could she do?
¿Qué deberías haber hecho?
¿Yo? Pues en ese momento debería ir al hospital, pero yo no supe cómo reaccionar. I should have gone to the hospital, but I didn't know what to do. I didn't know how to react.
Talk more about why she didn't go to the hospital. Talk more.
No, Bill, you're good.
Okay. What was your question?
Say more about the decision about going to the hospital and choosing not to. You're burned.
Okay. So, te quemaste. ¿Por qué decidiste no ir al hospital? ¿Qué pasó? Pues no sé, yo me espanté, no sé qué pasó, porque a mí el señor fue y dijo al dueño, dice, si está funcionando, está funcionando, dice, si no, dice, deja de trabajar. I panicked, and after I talked to the supervisor, his answer was, he kept insisting that it was working. He said, if you don't like, just stop working. Entonces, por eso no supe en ese momento, me dijo, dice, vete a tu casa y regresa mañana a las 7. I didn't know what to do. All he said to me was, go to your house and come back tomorrow at 7 a.m. Seguir trabajando. To continue working.
She doesn't work there anymore. Why not? She doesn't work there anymore. Why not?
Okay. Tú no trabajas allá más. ¿Y por qué no trabajas allá? Yo me salí de ahí por ese problema y porque no me daban break. Yo trabajaba 6 horas diarias, no me daban permiso para ir al baño, no me daban hora para comer, siendo que a las otras personas las mandaban a comer 1 hora y a mí no. I left because I was working 6 hours. They didn't allow me to go to the bathroom, to have lunch, or to take any breaks. Yo les pregunté por qué a mí no me daban break. Y me dijeron que porque yo estaba atrás y solamente les daban break a los de la línea, a los de atrás no.
I asked them why I didn't have a break, and they said because I was working in the back of the restaurant, and breaks were only for the people who work in the front.
Yo me salí de ahí porque por todo eso que estaba pasando y era mucho trabajo para una sola persona, no dejaban a uno descansar nada.
I left because I didn't like the environment, and that it was too much work for one person, and I didn't have the time to take a break.
Haciendo que en la línea había seis preparadores y ellos terminaban a las 2 de preparar todo. Yo les decía que me ayudaran, me decían que no. Y solamente se me ponían enfrente los 6 parados y me veían cómo estaba yo trabajando.
There were 6 people who were what is called the line, the cooking line, and preparing the food, and they could see me tired because it was just me alone, and they just looked at me and no one came to help.
Sí, yo pues ya no aguanté, ya no podía trabajar.
I couldn't take it anymore, and I didn't go back to work.
Yo me salí de trabajar y porque me salí, yo le avisé al manager, yo ya no voy a venir. No me quisieron pagar mis últimas 2 semanas.
After that, I told the manager I was not coming back, and they refused to pay me my last 2 weeks of work.
Let's take that experience, and I want both of you to talk a bit. Maria first, and then you, Gabriela, about the continuing kind of indignities of having to deal with not speaking English and how that plays out day by day at the workplace.
Lo que quiero que tú hables ahora es cómo la falta de dignidad de tener que hacer este trabajo cuando tienes la barrera de la lengua y tienes que hacer ese trabajo día a día.
Involving friends too. Involving her friends too.
Oh, y si tienes amigos que tú conoces que tienen las mismas experiencias, ¿cómo te sientes?
Pues me siento frustrada porque uno, trata uno de hacer el trabajo, de sacar todo el trabajo que uno puede, pero a uno lo tratan mal, lo ignoran, lo hacen, no sé.
I feel bad because even though I do my job and I work hard, I feel frustrated because I feel ignored.
Y sí, ahí quedaron unos amigos así, trabajando.
She still has some friends that are working just like that.
Gabrielle, talk about it too, because one of the things you do is you are the liaison for all the Arise Chicago people, including those who don't speak English as well as others do. What do they go through? What do you have to deal with?
Oh, in a day today, just to give you an example, I have 2 examples. One was a worker in a car wash. One of his friends was reversing and hit him, threw him against the wall with the back of the car. This right part of his body was broken arm, broken leg. They thought he was dead. And after he was at the hospital for 6 weeks, when he came back, he had a $130,000 hospital bill, and then the owner refused. Oh, let me rewind 1 minute. The owner told his wife, "Don't tell them that you work here. That I will take care of that when he comes back." 6 weeks later, the poor guy came back, and they refused to pay. Despite all the violations of the chemicals, not providing them with gloves, not providing them with, even safety when they are moving the cars, not training them and how to move the car properly to see the people who are behind, then he refused to pay. That is one example. Another one is a worker who worked at a company where they make books, the binders for the books. And that they use, actually, I never imagined that was possible. They use very loud machines in those type of works. They were supposed to give him plugs for his ears. After a long time of doing this work, he went home one day and he felt that his ears were ringing and buzzing. He went to talk to his manager, and they provided the plugs for him. However, he noticed even with that, after that, he was not able to hear, and the buzzing would not go away. He went to the doctor, and the doctor said, you have something called tinnitus. There's no cure for that. He's 56 years old. He cannot work anymore because, you know, he's just disabled. He said he has problems sometimes balancing his body because, you know, ears, you know, balance the movement of your body. I didn't know that. And at 56, he's just at home, very depressed because his employer didn't provide him the right equipment. And this happened. These are just two stories of the things that we face every day in our organization with workers because the employers don't follow the rules and they don't care. They treat them like machines. They don't see them as human beings that are doing a job for them to help them, you know, grow as business people. They just see them as nothing. As this machine that I'm going to use this week to help me as long as he or she can.
Let's bring this home. We're sitting in a hotel. That's where Francine's been working for 20 years, as I told you before. And as she and I were talking, it really made me think about something because I love the creature comforts when hotels do things better. And Hyatt's improving all kinds of things for us that make life much better when we go into our hotel room. What's it like for somebody who has to work that hotel room? Where we've got some improvements, for instance, some specific improvements. We have remodeled bathrooms now at the Hyatt, right?
Yes. Thanks for welcoming me. I worked at the Hyatt Regency for 20 years. I'm a room attendant. I'm with the organization United Here, Local 1, who's on strike right now at the Hyatt. And one of the reasons we're out there on strike right now is because of housekeeping language. And negotiations with Hyatt will not talk about. Hyatt have recently, between last December and this December, last December and December before then, to redo the rooms. There's 2,019 rooms in Hyatt Regency. There's 206 room attendants. We have.
Take out a piece of paper. You're going to need it.
They have recently remodeled these rooms, and the rooms are nice because it's competitive downtown. We got a lot of hotels that's opening up, so the rooms are nice. But behind the scenes, the people that does the room, like myself as a room attendant, you don't know exactly what goes on. And with these rooms, and like I said, it's really nice for you when you come in. It's laid out, it's your home away from home, and we're there to accomplish you know, make sure you have an enjoyable stay. But what goes on to get those rooms to that point cause injuries, and some injuries are ongoing. The beds are extremely grand beds. We don't use fitted sheets, we use regular sheets. It's 3 sheets to the bed, 6 pillows, then a big long pillow. These rooms are typically time fashion is like 20 minutes. They say 20 minutes for a stayover, and if you check out, there's 30 minutes for a checkout. So in these rooms, with that time, we do 16 rooms at the Hyatt Regency. They expect us to do these rooms in a timely fashion. So if 1,300 people are checking out, we also have like 1,000 coming back in. So there's a time frame in there that we have. It goes from 20 minutes to 30 minutes, from 30 minutes to 45 minutes. Again, something is not being done because we were rushing to get these rooms done for the next guest that's coming in. So in that time of doing that, ladies experience injuries from making the beds to their knees, their hands. Right now, ladies are starting to buy these gloves that you shower with, the scrub gloves. When they're buying these gloves to make these beds because we have to lift these mattresses, and it's hard to tuck those sheets like that. And the beds are extremely heavy, so ladies start experiencing fingertip problems, their shoulders, their hands. They got the bathrooms they remodel. They got walk-in showers. Ladies are starting to experience pain up in here. So it's not like the Hyatt has not been told. I'm a shop steward. It's about 30 of us that shop stewards and housekeeping. We all went to the manager and said, listen, these rooms are causing people right now to have serious injuries. And the Hyatt answer is, well, we have to discuss that in negotiation. No, we need to discuss it now because you got 20 ladies with injuries on light duty. High reason for light duty is so they won't be at home to recover properly. It's better to have them in the housekeeping department in the back, in this back room doing caddies. And caddies are stuff we set in with our amenities so we can finish our day. So their recovery is come to work and work your 8 hours and get paid for your pay, rather sit at home and recover properly. So this is the most ladies I have seen injury. Now it's 203 of us. It's 65% of the ladies do not report their injuries because they know they're not going to be at home to recover properly. So they don't report it. What they do is just take the pain pills and move on. But what that does is make the injury which they have escalate and escalate. And so they won't report it. So they'll just go home as a typical day, and then they have kids, they have to cook dinner. It doesn't matter what they have to do at home. Higher thing is come to work and just do what you can do. Do what you do. But we need these rooms. And that's how injuries start. So how you just right now, why we on strike is because housekeeping language has to be discussed. And all we ask them to do is drop a room, but it costs them hundreds and hundreds and hundreds of thousands of dollars to do this. So it's us, our health versus what you need. It doesn't matter about I have to go and take care of my son and help him with his homework or make sure things are done. It's just about getting what's done when you need it done right then and there. Now, they recently gave us, we had a big issue. We had, ladies cleaning the floors on their knees, cleaning the bathroom floors and getting their knees bruised up. Some ladies were having knees started getting fluid in their knees and their knees will swell up. They have to sit down. Some ladies are missing lunch, missing the 2 15-minute breaks because they're all trying to get this done. And a 7 hours and 45-minute job. In a day, they trying to get this done. And this is what Hyatt likes. So when they go and say Hyatt is the great workplace, we always remember, you didn't get there by yourself. You have an X amount of employees in this hotel, whether it's banquets, doormen, bellmen, cooks, convention service guys that set the tables up, or the waiters who brings the meals in. We all help you get there. You didn't get there by yourself. But Hyatt don't seem to think that's what it took.
Very good. We've got about we've got about 10 minutes left. 4 questions. As you think of questions, yell them out or stand up or come to the front or however you want to do it. Let me allow each of you.
Use your mic.
Oh, thank you. It's in my hand. I mean, it's not hard. Let me ask each of my cohorts here to finish up. You're talking to a group of policy people, mostly doctors, bureaucrats, professionals. Do me a favor and. Why is bureaucrats the dirty word in here or something? Tell them a message from the worker about what they ought to be thinking about and spending their time doing as they have meetings like this. Really, you want to start? And gather your questions together. We'll have a couple of minutes with you.
Putting a dollar sign on everything. We go down to Springfield, our union go down to Springfield, because the company said they don't have this, they don't have that, and state is always cutting. But I found out myself that this is a 500 Fortune company, because it's nationwide, the company that I work for. And we go down to Springfield, and we fight, for a better budget so they can keep their business going. Then we have to come and we have to negotiate with them. Say we want $1.75. We have to negotiate with this company to keep that $1.75. We have taken off our jobs, didn't get paid for, go down there talk to our legislators because we are the ones that voted me in and all this and that. And we go down there and we come back and we get a committee to negotiate with the company over this $1.75. And they only give us a nickel and a dime a year annual raise. And I feel that's a slap in the face, and that's a big joke, because we're the ones that are keeping your door open. We're the ones that really, you mean, like I said before, you have to love this job. It doesn't pay a lot of money, but you have to love this job to service. And these are your elderly people and your people with disabilities. These people worked hard, so they deserve a little bit more quality care, you know, and we negotiate with them, and matter of fact, we only get 70% of that money, and 30%, they said that is administration costs. All right, we have administration costs. What do the administrators give us? 20 gloves every pay period. Every 2 weeks you get 20 gloves. The case managers come out once a year to upgrade our cases, our clients' cases, and they cut their hours. This is administration cut. Or, you know, we're saving the state millions of dollars because we're in the house. We can't even get health insurance for us to make sure that we be healthy for it. I don't get it. I mean, am I waking up somebody's picture? Am I dreaming or what? You know, so, I mean, think about it. I mean, you know, like I said, my clients, they have to stay. I try to keep them out of the nursing homes. And I said all nursing homes are bad. And some people have to go to nursing homes. But if you want to, I mean, think about yourself. When you want to stay in your house until you perish or go into, I don't know the right word to use, but I mean, would you like to be in your own environment instead of an institution, you know? Or you want someone to come in and to take care of you, you know, and make sure that they have the facilities to take care of you. But they don't think that. They think we're pension. Oh, we can cut this out down. Or if we have public and private industry. Our public industry right now, we're fighting right now. They're telling us, oh, you only can wash a person up for so many hours per week, because now we're going to cut that person hour. Or you can go to the store for that person. Or the person has to go to the hospital, have no way to get no one to go with them, and you're the only person to go with them. But when your time is up, you just leave them and go on to your next client. Come on now, would you want me to leave your mother? You're at work and you depend on me to take care of your mother. But it's time for me to leave to go to my next client. I'm going to leave your mother at the hospital because I got to go, you know, because the state told me that's not my job. I have a heart. I wouldn't want to leave my mother there. So yes, think about it. I mean, you know, you're making us fussies and all.
María, ¿qué mensaje tú quieres mandarle a los señores aquí a nombre de tuyo y de los trabajadores?
Bueno, en mi nombre, mandarles mensaje que entrenen mejor la gente para trabajar en su propio idioma y que muchas veces los dueños de los negocios solamente contratan a las personas y dejan un encargado. Y no se fija si el encargado está cumpliendo las reglas que se deben de cumplir.
My message is to make sure the employees are really training employees how to use the equipment and train them in their language because of the language barrier. And also many places like restaurants, the owners are never there. They have people in charge of the place to make sure that those people who stay behind, who are not the owners, are also following the rules.
Ese sería mi mensaje.
That is my message. I didn't think of this. You know, I would agree with Maria in the sense that I think that is definitely, I would say, to make sure to enforce those rules of making sure people are properly trained. One of the things that I have seen from people coming to our, and I actually wrote the three of them here, is a lot of bad equipment. They are forced to work with equipment that is not working properly. These people are not properly trained, and also they are ridiculed when they come and say, hey, teach me how to use this properly. So create a program that truly enforces this, where people make sure that organizations are using the proper equipment and that it's working right, where the hot water is not going to fall on you and burn you, where people are trained in their own language, and that make sure that people are not treated like there's something mentally wrong with them when they want to learn how to use things properly so that they don't get injured. That is my message.
Very good.
My message is that these companies have to be held responsible for these injuries, whether it's restaurants, home care, or it's just simply an office type and you come with a compatona. These companies have to be held responsible of the injuries that's on the job. Just simple as that. Not push it up under the rug or fire somebody because their language is not like theirs, or they feel that they have been to school for so much education that they know everything. These companies need to listen and need to be held responsible for people's injuries.
Keep it up because you're effectively thanking all of the panelists for joining us today. So thank you, everybody. What's next for the rest? Thank you all.
I'm glad. Thank you.
Final thought.
Thank you for inviting me out to listen and hear my story, because sometimes you sit back and think, I've been looking at TV how people, our elder people haven't had a raise over 2 years on their income, and how disability people haven't had a raise, and how they think about now they're cutting their Medicaid, their insurance and stuff. And I'm like, I know how they feel because I work in that field. And one day we're going to get there.